Can you introduce yourself?
Yeah, hello, I'm Hemalatha. I'm 24 and I've completed my BSc Nursing in Bishop's College of Nursing, Dharapuram, Tamil Nadu, and I've got 2 years of experience as working as a clinical instructor come assistant lecturer. Till date, I'm working as a clinical instructor.
How many years have you been practicing as a nurse and in what areas of nursing?
I'm practicing for 2 years after I completed my BSc Nursing. The areas which I am practicing are medical surgical nursing, pediatric nursing and psychiatric nursing.
Can you describe the types of hospitals you worked in?
Yeah, I'm working as an assistant lecturer and clinical instructor in JKK College of Nursing, Kumrapalayam, Tamil Nadu. My college also has an attached hospital which is 50 bedded. This hospital is not adequate, so we are moving up to the government hospital in Erode. It is a multi-speciality hospital and it is 500 bedded.
Why did you choose nursing as your profession?
Nursing is a noble profession. From my childhood, I am very soft-hearted, and whenever I see people over the platforms or any poor people, needy people, old-aged, orphan, I used to think that I should do something for them and for the improvement of their life. And so, as I grew up, I thought nursing is the prompt position for that. So I chose nursing.
What are the most challenging aspects of nursing? Provide us with specific example from a hospital setting.
Although nursing gives us so much of peace, it has its own challenges, including the caring of patients. We have so many things to be dealt with in nursing. According to me, I feel dealing with a terminally ill patient is very challenging because I was working in the medical surgical department in the ward, and there was a patient who is 45 years of old and suffering from lung cancer, and this patient is in his terminal stage, and I felt very bad about this patient, and this patient was feeling so much because he's going to die. And I used to give him so much of emotional supports, and I'll give him relaxation techniques. Whenever I find time, I'll go sit with him, talk with him, and I'll take him to a walk. I'll provide him musical therapy, and it took 3 to 4 weeks for him to manage his own condition, and at last now he's ready to face anything in his life, and he feels comfortable with the life, what he's going on with. So this was a challenging experience for me.
What is most rewarding to you as a nurse? Provide us with specific example.
Giving care at the proper time in an alert manner is a very important thing in nursing. Once when I was working in pediatric department, there was a 2-year-old child diagnosed to be hydrocephalus, and ventroperitoneal shunt has been done. And one fine morning, when I entered into the ward, the mother came up running. The child is crying from the last night and it has not stopped crying. So when I rushed out into the room and saw the baby, I found the baby to be more restless and the pulse was down, and it showed all the signs of increased intracranial pressure. So immediately I rushed to the doctor, called him, and as soon as possible he came out into the ward, and we all started to resuscitate the baby, that is making the baby to come to normal, but we were starting to milk the tubes, but nothing was done properly that time, and so we were in a situation to get the patient again to the surgery, and re-surgery was done, and after a few days the patient has to be in the ward for 14 to 20 days. After that, the baby has become normal and it started playing as a normal child, and the attenders, the relatives, the mother, everybody were very happy, and this was a remarkable situation in my nursing life.
Describe how you work with doctors in various circumstances. Give specific example of how you respond to instructions and communicate effectively to doctors?
On carrying a patient, it is very important that all the health team members should work together and care the patient so that the patient's prognosis is good. So I usually follow all the orders of the doctor. If in case of emergency, I'll immediately inform the doctor to check the patient again and follow up the treatment. So on carrying a patient in any ward, even if it is a minor treatment or a major treatment, it needs all the doctors, all the physiotherapists, nurses, biochemists, x-ray lab technicians, everybody to work as a team to make the prognosis better. In a neurosurgical ward, while I was working a year ago, there was a patient with neuroblastoma. So, starting from the personal hygiene till the technical work, everything is done by the health team members. So, the neurosurgeon is informed about that, the physiotherapist is informed properly, all the nurses, the ward boys are all informed that care should be provided for the patient, and we all worked as a team together to make the prognosis better, and the patient was feeling better a few days after. So I would usually I feel happy that I normally carry all the orders of the doctor, all the prescriptions of the doctor. If I have any doubts regarding the prescriptions, I'll call him again and I'll ask him and follow it up again.
Describe your work ethic using specific example.
Nursing ethic is comprised of sincerity, honesty and punctuality according to me. And while I was working in the medical surgical department general ward, there were 45 patients in my ward and 2 nurses, myself and my colleague. She is a good friend of mine. There were 12 patients with tube feedings. But one fine morning, a patient kept on informing me that he was feeling hungry. So actually, the tube feeding has to be given 2 hours before that. So I went on and checked the shelf and I saw that the previous feeding was not given. I was feeling very bad. Although the patient was assigned to my friend, I gave him my feeding and I came back. Although she is a good friend of mine, I need to keep my nobility of my profession. So I took this complaint to my nursing supervisor, and my friend was punished for that.
Describe a patient care case from your hospital work that you were a part of and that it made you feel like you performed above and beyond the call of duty.
Yeah, once when I was in triage, a patient came after a road traffic accident and he has been severely injured with basilar fracture and right upper arm fracture and the femur fracture, and he also had lung contusion. So he was immediately put into ventilator and was immediately sent to the ICU unit. So after a few hours, the electricity has gone and immediately I was remembered of the patient over there. So I just rushed there into the ICU and found only 2 nurses are there. It is a 10-bedded hall and only 2 nurses are posted there, and 4 patients were in ventilator. So 2 nurses were ambuing 2 patients and the other 2 I saw struggling for breath. So I immediately called in for the neighbor ward nurse to come again immediately into the ICU, and we went in and started ambuing. So those patients it was 30 minutes for us when we completed ambuing and when the electricity came back. By that time, because of 30 minutes of continuous ambuing, all our hands were paining, but after we survived the patient, our hearts smiled. So after 2 to 3 weeks after that, in the general ward, when I was crossing over, I saw the patient over there, and his mother came to me running with tears rolling down her eyes. She just held my hands and said and thanked me for what I have done. So it was a very remarkable and memorable incident in my life, and this I think is above and beyond the call of my duty.
Would you like to close with any comments to your future employer?
I would be obliged if I work under your kind concern as an instrument of God, and I'll prove myself to be very vibrant, dynamic, energetic and potential in serving the society.
All the best, Hemalatha. It was nice talking to you.
Thank you, ma'am.